We are getting tons of viewer questions about the coronavirus pandemic, and we're trying to answer as many of them as we possibly can. Here to help me do that, Dr. Anand Parekh. He's the former Deputy Assistant Secretary for the Department of Health and Human Services. He has experience with bird flu, swine flu, Ebola outbreaks. Doctor, thank you so much for being here with us. We'd love to address some viewer questions, but first, President Trump was talking about the possibility of a new testing process earlier. I'd like to play that.
We're working with several groups to determine if the self-swab, a much easier process than the current process that's not very nice to do, I can tell you, because I did it.
The president continues to say the swab process not so nice to do. What do you think about this talk of new testing, potentially a self-swab?
Well, I think it's interesting. I think we need to see where the research is. The current test is not always pleasant. You really it's nasopharyngeal, so something that goes in through the nose, through the back of the throat, to try to elicit the droplets and the particles and the coronavirus there. So I think the self-swab is interesting. I think we have a lot of other issues that are more paramount at this point in terms of testing, getting testing kits out there, getting the processing time down. Ensuring there's communication in terms of where to get the testing. Certainly, as we progress, if we get to a point where it's a simpler test that individuals can perform on their own, I think that's great. But there are a lot of elements here when it comes to testing.
There's been a lot of talk about how the government has done in handling the coronavirus, and I don't want to get political here, but I just would like your take. Do you think the government has done an adequate job navigating the coronavirus? And if not, what are some of the things that you would like to see happening?
Well, I think it's been a tale of two responses. I think the first response was a bet on containment that the White House made, and unfortunately that did not work, and we lost about a month, a critical month. I think this over the last couple of weeks, you have seen, particularly as cases have expanded out from China into Europe, the White House really take this much more seriously, that this is a pandemic virus, that mitigation is going to be absolutely critical. And so I think the steps that you've seen, particularly in the last couple of weeks, the public communication, the focus on testing, the focus on social distancing is absolutely critical. I think from here on out, there has to be a focus, and you heard about it today with the invocation of the Defense Production Act, in surging critical medical material, as well as PPE, the personal protective equipment, to the healthcare workers who are going to be on the front lines of this surge that we expect to see in the coming weeks. So very quickly getting that material out is going to be really, really important. And so all of these things, the testing, the social distancing, as well as preparing for the surge, are really the three areas of focus moving forward.
On that social distancing note, we're here in New York, a city that is currently considering whether it will put into effect a stay-at-home order. What do you make of those orders that we're seeing in some parts of the country? Is that a good idea? Is that an effective method?
I'd advocate for New York City right now. I think Bay County officials a couple days ago did the right thing. You know, shelter in place doesn't mean martial law. All it is really alerting the American public or the residents there that you need to limit non-essential movement, non-essential travel. It certainly exempts critical infrastructure, first responders, pharmacies, healthcare settings, grocery stores, and businesses like that. But we absolutely need to get the message out to stay home. I think what we all want is not to see anywhere in America a situation that we're seeing right now in northern Italy, what we saw in Wuhan. And if you look across the United States right now, what are the one or two spots that we're all the most worried about? I think it's the Bay Area, and I think it's New York City. Yeah. So absolutely, I think New York City and the jurisdictions in that area, you can call it, whether it's a shelter in place, whether it's a modified quarantine, whether it's with National Guard or not, that is what we are absolutely concerned about. And I would social distancing. That's that as well as forward deploying our critical medical material. That's how we can bend the curve right now. So whatever we can do to get the message out, to stay home, to do social distancing, we should do.
Yeah, and look, just anecdotally, living here in New York, working in New York, you can see that some people just perhaps don't realize how dire the situation is. Walking in today, I was just surprised by how many people were still out and about. We've heard stories of Central Park packed with people exercising, people in my building talking about doing a group workout together. I think a lot of those things don't exactly fall under this social distancing that you're talking about being so essential.
I think you're absolutely right. I think the message that I would have for the American public is stay home. Do the right thing. We're so lucky in this country that we have freedoms, but with freedom comes responsibility, and we need to exercise these freedoms judiciously. And I think at this time, social distancing is what we have. And so I think that message needs to be heard loud and clear. And that's not just for those at highest risk. It's really for all Americans, because all of us can be transmitting the virus. And in many cases, unfortunately, asymptomatically. That makes this all the more important.
All right. I have a pretty lengthy list of viewer questions here. Is it OK with you? We try to tick through some of them, give some people the people some answers.
Sure. Happy to do so.
All right. Thank you so much. One of our viewers asks, is it safe to walk outside with my 87-year-old mom? She lives alone. Is it okay as long as we walk with an appropriate distance between us?
I think that's perfectly fine. You definitely want to, check on relatives and family members. And I think in this particular case, as long as you're employing social distancing, 6 feet, and it's really the measure that we go by, I think that's perfectly fine. We want to make sure that social distancing doesn't equal social isolation. So again, checking on relatives like that, going out for walks. Very, very small groups like that, 6 feet distance. I think that's perfectly fine.
All right. How about doctor's appointments? I got a call from my dermatologist this morning saying my appointment in 2 weeks was canceled. I was thrilled. Should people be rescheduling routine doctor appointments or dental work even?
Well, I think anything elective, you really want to postpone. Of course, healthcare facilities are going to be open. So I think in terms of critical needs, that's where you want to go. I would always say call first, so you understand the triage situation, understand what you can do over the phone, what you can do through telehealth now. There are new provisions out there. So I think that's all important. I will add just one more point to your prior question about the elderly. It is very, very important for particularly for all Americans, but particularly for the elderly, to stay home. Again, I think if it's a short walk, again, with a relative, somebody, a household contact, within 6 feet, I think it's okay. But I think we do need to be very careful. I want to make sure that I send the right message out there, that the first sort of order of business here is try to stay home and stay healthy.
All right, let's talk about underlying conditions, lung conditions. We know that people who have those are particularly susceptible, but how about smokers or people who used to smoke but don't any longer? Are they at greater risk, and should they be particularly concerned here?
Well, we're learning, more and more, so we don't have definitive answers. But absolutely individuals who are long-term smokers who might have lung disease, chronic obstructive pulmonary disease called COPD, they are likely going to be at higher risk. So they're in the high-risk category. Anyone with a serious chronic condition, a heart condition, a lung condition, kidney condition, anyone immunosuppressed, those are the individuals when you look at the data in terms of who's being hospitalized, who needs intensive care, and those are the individuals that we're most concerned about.
All right, as people try to go out to the grocery store, get the kinds of foods that they need, I know some places in particular happen to have a lot of great fresh produce still, which is wonderful. Can the virus live on fruits and veggies, people are asking, and is there a best way to wash, clean them, if you just want to get some fresh, healthy food in your home?
Yeah, no, I think, practice good hand hygiene, when you go to the grocery store, try to go alone. Make sure that you are maintaining social distance. I think fruits and vegetables are perfectly fine. When you come home, you wash them, wash your hands. There has been no evidence that the virus can be transmitted that way. Now, of course, if someone were to, cough or sneeze, and droplets just went on that food, and then all of a sudden you touched it with your hand, and then you touched your mouth or your nose or your eyes, then it could theoretically be possible. But I think as long as you're doing sort of the basic common sense here in terms of washing your hands, washing the fruits and vegetables before you eat them, I think it's perfectly fine.
All right, I lied. I know I said last question, but you brought up the droplets, so I have one more because it's on our list, and a lot of people have been asking. If someone coughs into the air, I know this happened to our producer Christina the other day. Someone coughed near her, and she was nervous about what to think. If someone coughs into the air and there are droplets there, is this airborne? Can you end up picking it up if it lingers in the air for a bit?
Yeah, I know there's an important study that was published in the New England Journal of Medicine today and some articles. I think most experts still believe that the virus is transmitted through large droplets and within 6 feet. And so all the respiratory etiquette that we talk about has to be followed. In terms of the virus being aerosolized, you really need this is really focused on healthcare workers who are doing procedures on these patients, oftentimes connecting them to breathing machines. In that case, the particles that are being released are oftentimes very small. And so those individuals, healthcare workers, need to be wearing not just masks, they need to be wearing what are called fitted N95 respirators to keep these small particles out. They need to keep them on for about a half an hour per this study, and then you need to clean all of the surfaces. So I think it's really, in terms of aerosolized, the worry there is really for healthcare worker protection, infection control practices. We want to protect them. But for the general public, most experts believe, again, right now, it's droplets that we need to be worried about. And again, wash your hands, keep your distance. Some environmental cleaning is also prudent, given that this study showed that the virus can live on cardboard for 24 hours, as well as metal and plastic up to 72 hours. So everything about sort of the regular cleaning and disinfection is probably a good way to go.
All right, so many questions from our viewers. Dr. Parekh, thank you so much for helping us get through so many of them. Very much appreciate your expertise.
Thanks for having me.